Welcome to the Pathways to Wellbeing documentation course, Pathways to Wellbeing Progress Report to Child Welfare Services form. This course is one in a series of learning opportunities designed to help familiarize you with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. This course will introduce the Pathways to Wellbeing Progress Report to Child Welfare Services form, a document that supports collaboration between behavioral health services and child welfare services. This short course is designed to familiarize you with the Pathways to Wellbeing Progress Report to Child Welfare Services form. You will learn what the Progress Report to Child Welfare Services form is, when to complete the form, how to access the form, specific steps for completing the form, and some helpful tips to support you along the way. The Progress Report to Child Welfare Services form is used to guide behavioral health services or BHS providers and child welfare services or CWS with the required collaboration for youth who are eligible for Enhanced Services subclass or eligible for Pathways to Wellbeing class. Cross-agency collaboration is important to provide quality care and to ensure mental health records such as consent for treatment, client and service plans, the Child and Adolescent Needs and Strengths or CANS, and Child and Family Team or CFT summary and action plans are reviewed and shared between BHS and CWS. This form is used for all youth who have an open CWS case, including voluntary services cases, and are receiving services through a BHS organizational provider. This form is completed by the BHS provider upon completion of the KDA section of the Behavioral Health Assessment, or BHA, completion of the Eligibility for Pathways to Wellbeing and Enhanced Services form, and entering a Pathways to Wellbeing designation in the Client Categories Maintenance, or CCM tab, in Cerner Community Behavioral Health, or CCBH. For further information about completion of the Pathways to Wellbeing section of the BHA, how to complete the eligibility form, or entering the Pathways to Wellbeing designation in the CCM tab in CCBH, please refer to the other documentation microlearnings in this series. BHS providers complete the Progress Report to Child Welfare Services form for all youth that have an open CWS case, including voluntary services. The form must be completed within 30 days of determining Pathways to Wellbeing eligibility. When there are any updates or significant changes, including a revised client plan or a change in the youth's subclass or class designation, or when discharging a youth from a BHS program. Updates or significant changes can include a change in clinician or when there is a change in Pathways to Wellbeing designation. Examples of a change in Pathways to Wellbeing designation can include when a youth is determined to be eligible for Enhanced Services subclass based upon being considered for more intensive services, such as wraparound services and short-term residential therapeutic program, or STRTP, at which time the form would be updated from class to subclass. Or when the youth shows progress in treatment and no longer requires intensive services, at which time the youth's designation would be updated from subclass to class. When the form is updated, any documents that have been updated will be exchanged between BHS and CWS through the outlined process. The Progress Report to Child Welfare Services form is found on the RISE Pathways to Wellbeing webpage. The site URL is displayed on the screen. Scroll down to the Tools and Forms section to find the form. You'll also find an explanation document that can help you fill out the form. VHS providers are responsible for identifying the CWS region of the Youth CWS Protective Services Worker, or PSW, by contacting the PSW. For current PSW contact information, providers can call 858-514-6995. When the form is completed, providers will fax the form and accompanying documents, such as the completed CANS tool, to the Health Education Passport Office Assistant at that CWS region's fax number. The fax numbers for all CWS regions are listed at the top of page 1 of the Progress Report to Child Welfare Services form. If you are unable to fax the form and documents, you may securely email them directly to the Youth PSW. Page 1 of the form is administrative and not included in CWS court reports, except for the client plan. VHS providers will indicate whether the youth is designated as subclass or class to align with the KDA section of the BHA and the date entered in the Pathways to Wellbeing and Enhanced Services form and entered in the CCM tab in CCBH. The left section of the form, titled VHS Provider, requires sending several documents to CWS. These documents will provide essential information regarding the youth's participation in mental health treatment and will enhance collaboration. The current client plan will be attached to the form and must be submitted at initial timeline and resubmitted upon any client plan revision. The client plan can be utilized for CWS for court reports. If the program was granted core approval to facilitate their own CFT meetings, the program will attach the most recent summary and action plan. The current completed CANS tool results includes the entire completed CANS tool, not just the CANS summary page. The current assignment history from CCBH needs to be submitted at the initial timeline. This includes complete history of open and closed assignments. The discharge summary will be submitted after the client is discharged from the BHS program. On the right side of the form, titled CWS PSW, check the boxes next to the documents requested from the CWS PSW. The CWS PSW will send the requested items to the BHS provider. Please note, the boxes must be checked for the CWS PSW to send the documents. The CWS forms will inform the BHS providers of the pertinent CWS information and can assist providers in formulating goals to include on the client plan. The CWS PSW may use page 2 of this form, along with diagnostic information and the client plan from the BHS provider and court reports. All elements of page 2 must be completed, including the child or youth's name, date of birth, and date of admission to a BHS program, the BHS program and clinician name and contact information, and the child or youth's diagnosis. Some helpful tips to remember. Inform the CWS PSW that the progress report to Child Welfare Services form is being sent to ensure that the PSW has received important documents in a timely manner. Maintain a copy of the progress report to Child Welfare Services form as it was sent to the CWS PSW in the Youth's Hybrid Chart. Billing for gathering of information for the progress report to Child Welfare Services form will only occur when connected to a direct client service. If there are any questions or concerns regarding collaboration with the CWS PSW, please contact the BHS Pathways to Wellbeing program. The Pathways to Wellbeing team roster can be found on the Pathways to Wellbeing and Continuum of Care Reform page on the RISE website under Contact Us. The site URL is displayed on the screen. Providers must complete the Progress Report to Child Welfare Services form for all youth that have an open Child Welfare Services case, including voluntary services cases. In this course, you learned what the Progress Report to Child Welfare Services form is, when you need to complete this form, and how to access, complete, and send the form and associated documents. You also learned some helpful tips to facilitate communication and collaboration between BHS service providers and the Youth CWS PSW, and some resources if you have questions about how to complete and send the form. We encourage you to review the other courses in this learning series. Thank you for attending this course.